to avoid large-scale recession in the region, we need two important things. High-quality immunization coverage. That means you need to have 2 doses of measles vaccine, as well as a strong surveillance system for early detection and response. And in the last few weeks, I have sent a letter to all the ministers within the region of Western Pacific, recommending to them the outbreak risk assessment that need to be done, and a high quality vaccination, and to strengthen the surveillance system and the capacity of countries for outbreak detection and response. We do expect the measles outbreaks to spread to our member state in the region, and I think this is very important. We see cases now in Vietnam, in Malaysia, Laos, and I think this is important for the region to be aware, raise awareness, and work on preparing and strengthen the health system if there is an outbreak of measles in the member state.
Now, in relation to this, previously for 3 years, the world focused on COVID-19, and at that time, as has been said by the regional director, the immunity or protection in relation to other diseases that were vaccine preventable suffered because the vaccine uptake in many parts of the world decreased. Now, we are seeing as a result of this, some of these outbreaks of measles and pertussis around the world, and therefore our aim is to use the lessons from COVID-19 to help us to strengthen our health systems and health system infrastructure in order to be able to respond appropriately to these actual emergencies. And as you also may be aware, when we talk about COVID-19, you may be aware of the pandemic agreement, which is being discussed in Geneva at this time. And this will also help to prepare the world against future pandemics, such as the one that we have seen in relation to COVID-19.
So we continue to work with the Department of Health at the central level as well as at the subnational, including BAM and also municipality level. And at the national level, the Department of Health has activated Emergency Operations Center, of which WHO continue to be part of it, and we have the meeting every day to look at the current situation and also analyze the situation, including the challenges in the field, and we discuss with the authorities at the subnational level to address the challenges facing the situation in BAM.
This is a challenge for the whole region, not just Philippines. But yes, some countries have lower vaccination coverage rate, so they are at a higher risk, especially Philippines and Papua New Guinea, also a few other like Malaysia and Laos. So as Regional Director mentioned, we have sent out letters to all member states to ramp up the routine vaccination, but also wherever required to do catch-up campaigns. And at the same time, apart from this immunization, we have to strengthen the surveillance and response systems to diagnose these outbreaks early through epidemiological and laboratory investigation, so that we can take rapid action to prevent further spread. So immunization and surveillance and response, both are important. Thank you.